Welcome back, loves, to the Anxiety and Free podcast. I am so excited that you stuck with us through season one, and now we are entering season two. And I wanted to take a little break, but I thought, you know what? Let's just keep going. Let's not take a 2 week break. Let's just do this thing because anxiety is only creeping up for everyone. So I want to first introduce the theme for this season, which is Inside the Session, a Therapist Playbook. And I'm just going to give you a little short background of why I wanted to do this for this entire season. I think too many people are going to therapy and not getting their needs met, and or they're leaving consultations with therapists and they have no clue how their therapist is actually going to help them. So I thought it would be great to have myself share some things and then also some other psychotherapists come on and share how they treat specific conditions when we're looking at clients and their different life experiences. So this is going to be an exciting season. And today we're talking about understanding addiction and therapy. And I'll be honest, I was a little hesitant to talk about addiction. And so I said, I need to bring on an expert to talk about addictions because it's not my specialty, right? And anytime we don't have a specialty in something in psychotherapy, we need to refer out, we need to consult out. That's what we're doing today. We're talking to someone who can talk to you as an expert in this field. So let's talk about understanding addiction and therapy. But first, I'm going to introduce our beautiful guest to you. I'm delighted to introduce her today. She describes herself as a friend, daughter, sister, therapist, and a human, okay, flawed like everyone else. And she's always seeking opportunities to grow. She has been a psychotherapist for 9 years, and she recently started her private practice in March of 2024. She finds her work to be an honor. I love that about her. She deeply values the trust people place in her when they share their stories and seek support. She is passionate about making the often difficult step of asking for help as comfortable as possible for those who reach out. Welcome today, our guest, Jennifer Lipkins. Welcome, Jennifer.
Thank you so much for that lovely introduction.
You are so welcome. I'm so excited to have you on. And y'all, I know Jennifer personally. So she's one of the best people to talk about this because when I first met her, she started telling me about some of her areas of specialty. And when she talked about addictions, I thought, oh my goodness, I was always intimidated with addictions work. And she just talked about it like, girl, I love addictions work. And this is how I see it. She had such a unique approach and perspective. And I had never heard anyone talk about addictions work like that before. So I said, okay, I got to get to know you. I want to know more about how you work with people. Give me some of that energy. So you feel addiction actually isn't talked about enough or understood enough. What are some of the biggest misconceptions that you encounter in addictions work?
So, one thing is there's a difference between substance abuse and addiction. Someone can abuse substances, including alcohol. I know in the DSM, it's a completely different category, but when you look at all the symptoms underneath, it's exactly the same. So, substance abuse is very different from addiction. Addiction is something that is more of a compulsion and something that you give into, and it's very hard to control that urge. I think one of the other biggest misconceptions is, well, why don't you just stop? People say that all the time. Why don't you just stop? Well, I'm pretty sure if they could, they would have.
Yep.
This wasn't like the thing that they didn't think of. They thought of, well, I'm just going to stop. Well, it didn't work, guys. So
Yep.
that's why it's not super easy. And part of why it's not easy is because it's a whole lifestyle change. And I think that's the other thing people don't realize. Yes, there is genetic to that also, but this is also a learned behavior as well. And it's unhealthy coping skills that people have learned over time, whether it's been taught or they learned on their own. And there was a time where it worked for them. But just like all unhealthy coping skills, there's a point where you're going to hit that wall and it doesn't work anymore, no matter how hard you try. And that's what addiction is. Addiction tricks you. And the addict brain is like, but remember that one time it worked, and it's going to
Hmm.
hold on to that. So there are a lot of components to addiction, and it is not easy as just going, well, you could just stop. It's just not that simple.
Yeah. Thank you for sharing that. I feel like you just dispelled so many myths just in your
I am so
really.
glad.
In your initial response, you're basically saying, "Look, to treat addictions, it's a lifestyle shift for people." And you're
Yes.
talking about coping and how, hey, it actually once worked. I think that's the part that's so challenging for people
Yeah.
who are struggling with different types of addictions. And then also the part that their loved ones, they struggle with that. Like, "We were fine
Yeah.
before, what happened?" Well, it escalated to a point where it's no longer working
Yeah.
and it requires treatment, okay? Like, anyone listening, if you have someone in your life who's struggling with addiction, it requires treatment. Okay, like
Yes.
simply put. And so I wanted to say that again, Jennifer, because what I hear often is people say, "Why don't you just quit? If you love me, you would just quit. If you cared about your career, you would just quit. If you wanted to get off the streets, if someone was homeless and really struggling and living on the streets, if they wanted to, they could, right? It requires treatment." So if you think about that person who's struggling on the street, or even the person who's like struggling to survive and get by on their lower income, well, addiction treatment costs money. So
Yeah.
if we're
It
saying it's
does.
required, but it costs money, then we can't just say if you wanted to, you would.
Exactly. And it is so hard. And I think that is the other thing people have to understand. I think it's really great that you said this. If you loved me. And the thing is, when someone suffers from addiction, they have to quit because they want to. In my experience, it has never worked when someone doesn't do it for themselves. Because what happens, if that relationship ends or unfortunately that person passes away, now that person is like, well, I don't have a reason to practice sobriety anymore. I don't need to be in recovery. You have to want it. You have to believe in the benefit. You have to do it for yourself.
Yeah. Yeah. I think that's so important to highlight. And you're just making me, as I've been doing this podcast, like people say things. And then, of course, I start thinking about the people I've worked with and some of the best outcomes when people say, you know what, I love the people around me. I love the work that I do. I love making an impact. So it's so important that I'm healthy for those people. And ultimately,
Yeah.
I'm learning to care more for me. And I'm learning that I've got to love me enough to make this change because it starts with you. You
Yes.
can't be the person you want to be if you're struggling. So, yeah, I think that's gonna reach someone. I really hope it does.
Yeah. I hope so too, because it is really true. We can't show up for others until we show up for ourselves because we don't have the battery life otherwise. Our battery has to be full or we can't be there for someone to lean on once in a while.
Yeah, yeah. Oh my goodness. Ooh, I'm thinking of so many questions, but I'm gonna keep the next question in my head, I'm gonna go with it because
Okay.
I will have us down so many lanes. You know me at this point.
Yeah. We'll be like episode 2 coming soon.
I know, right? Like, okay, part 2. We gotta have a part 2 apparently.
Okay.
So, for someone who might be struggling with addiction, what's one of the most important things you wish they knew?
You're not alone. But not only are you not alone, there is space for you to be heard. Reach out to a therapist. Do not do this on your own. And it's not as simple as going to a 12-step program. I'm not shaming 12-step programs. I think they are incredible. It is important to have support from people who are on a very similar journey to you, but that is not evidence-based research therapy. And that is two very different things. Whereas one is a guide, one is evidence based research that these things work. It is important to combine a support group with therapy. That is something else that's just really important because one is clinical. And yes, you should have this amazing relationship with your therapist. So if you don't vibe with that person, please go find someone else. In addition to your amazing therapist, you have to have that personal support. You have to have that other person who's like, you know what? I get that because of my experience. And there's just something really special and validating when having that relationship with someone who just really sees you.
Yeah. Oh goodness. You're making me think about my past experiences and working in addictions. I told you my brain goes everywhere. I agree with you. It is so important that people recognize that therapy, that's you get the clinical, the evidence-based support
Yes.
and support groups like the 12-step groups. They're so helpful. It's supplementary though to the work that people do in therapy and or treatment programs, depending on the severity, I imagine.
Yeah,
They might need a treatment
right.
program. So, yeah, I'm curious now when you think about the work you've done in addictions, because I'm also thinking about the work I've done, and I did community mental health, so it was in-home therapy like
Yeah,
10 years ago.
yeah,
And there wasn't much family support other than, "Okay, I'll
yeah,
leave the room or I'll leave the house so you can go do your therapy." And
yeah,
even though that, loved one, that family member or friend was also being impacted by the addiction, they didn't really want anything to do with it. It was almost like, "Go over there and get your treatment and then come back. Are you getting better?" So how important is that support when it comes to loved ones, relatives, community?
yeah. It is priceless. And I'm really glad you brought this up because it is one of the most important things. It is not just the individual going through this. It is every person that that individual touches. Our lives, we don't live it in a bubble. So that might mean that that person's partner practices sobriety too. That might
Mhm.
mean, hey, we have a substance free household. We don't have alcohol. And that person that's part of the support. And the other thing I often hear is, I don't want to burden my partner with that. I don't want to burden my family with my problem. It shouldn't be a burden. And here's the other thing. If it is, do those people also have a problem? Are they enabling? Because
Yeah.
if they really want to support you in getting better, they also need to do certain things. At times, maybe you share with your friends, hey, I can't go to a bar. I can't go to this club that we used to always score at. It's a trigger for me. Can we get coffee instead? And this is unfortunately where you also figure out who your people are. This is very similar to other major life transitions that a person goes through. You find out who your people are. And that's why therapy is so important right now during this time. That's why support groups is so important because it can feel very isolating. Even though you're not alone, it can feel so isolating because it feels like, and oftentimes is, being over.
Yeah. Oh my goodness. You just made me think about what you said earlier about the lifestyle change. It really
Hmm.
is. And I hear
Yeah.
from people who stop drinking or smoking or whatever, and they'll tell their friends, "Oh, I can't go to that restaurant or that bar," so on and so forth. And they're told, "Well, I'm not the one who has the addiction. You're the one that's struck. Like, why can't you just, if you're giving it up, then okay, give it up, but still come." And that's not support. That's
No,
not as
it's
supportive
actually
as people could be.
shaming. No, it is shaming someone. And, it's not too different from when, and I know mental health still has a bit of a stigma, but mental health stigma. Like, oh my goodness, there's something wrong with you. No, it's no different than what we go to the doctors for. We have to have a diagnosis to categorize the symptoms so we know what treatment we need.
Yep, yep, you're so right. Oh, and you know what I'm thinking about? I don't drink alcohol, and, we move a lot.
Yeah.
We've moved like 5 times since I've been married almost 14 years. And so each place we go to, I meet new people. I connect with different social groups. And I used to get hesitant when people would order drinks and they're like, "What drink are you ordering?" And and over the years, I just learned to say, "This is me. I don't drink." And so my joke is, "Hey, I don't drink. I'm still a good time. All right. I'm still going to keep you laughing at the table."
And you do. You do.
Hey, she can attest. She can attest to this.
Yeah.
And that was something that always lightened the mood for me because it's always a
Yeah.
shock to people when I say I don't drink, and then it invites questions like, "Oh, just curious, is it religious? Did you ever have an issue with anything?" And I've never
Yeah.
had an issue with addictions around alcohol. There are many reasons why I don't drink alcohol, but it could, like, I just knowing the pressure that I felt in telling
Mhm.
people I
Yep.
don't drink, I'm ordering a non-alcoholic beverage. I could just imagine the weight someone feels when they've been a part of a social group that drinks, that like everything they do is centered around drinking and connecting in that way, and then all of a sudden that's taken away. It made me
Yeah.
think about that lifestyle shift and really that need
And
for
yeah, it
support.
totally is a lifestyle shift because if the people around you are enabling unhealthy behaviors, are those people you should be around? Are those
Mhm.
your true friends?
Yep, yep. Goodness. Okay, so I have to ask this question. What are your thoughts on interventions? You know how we used to see on TV, they do
Yeah.
an intervention. What are your thoughts on interventions?
I think they're needed at times, and I'm sure they do work. I have never participated in one. But again, when it comes down to it, that person has to want it. I think it's an opportunity to enforce a boundary, which is just really important for those people who are suffering because of that person who suffers from addiction. They're able to share, like, this is what your actions do to me. And sometimes the boundary is, if you don't go to treatment, I can't continue being in your life. And it's not an ultimatum. That's someone just sharing, I need to take care of myself. And when you're healed, I am here for you. But until then, kind of going back to what you had said about taking care of yourself so you could be there for
Mhm.
others, I need to take care of me. I no longer want to be treated this way.
Yeah. Thank you for sharing your thoughts. I know it's more controversial in the addictions field.
Yeah.
Like some people are for it, some people aren't. Anytime I've interacted with representatives from addictions fields and even in just the work that I've done in the past, families always invited to come and do family therapy and speak about,
Yeah.
hey, this is how the addiction has impacted us. This is how it's impacted our relationship. Didn't feel like I could be honest before. I'm going to be honest now. I think interventions can be very helpful and productive, especially if people are kind of prepped for it instead of everyone attacking the person who's struggling.
Yes. And I think that is the downside, right?
Yeah.
Yeah, there's this great opportunity, but there's also this person who is being attacked, truth or for fiction. Like, it could be real, it could just be their perception, but it is a lot being dumped on that person. So it does have to be done right. And it doesn't work for everyone.
Yeah. Yeah. That's why I'm so glad there are different ways. There are a variety of ways to help people with
Yeah.
addictions.
Yeah.
Yeah. We'll
Exactly.
get to some of that too. I can't wait till we get to that question. So many people have questions or feel intimidated by the idea of therapy. What's one common question or stereotype about therapy that you feel is important to address?
I think the biggest stereotype is therapy is only for big problems. That is not true. It is not. Therapy is a space for you to feel safe, heard, and seen. So, whatever you have going on, if you're even thinking about, do I need therapy? Call therapists. Call
Mhm.
therapists. Maybe you just need like one or two sessions. Therapy doesn't have to be a forever thing. We're there to help you develop the tools to be the best you can be. And then you break up with us, and that's okay. That's just part of it sometimes.
Yeah, yeah. Which is, I think our field is so unique in that way because
Yeah.
we get to know people on such a deep level. Of course, it's
Yeah.
once mostly one-sided, but you know people on such a deep level. And then when they have to terminate because they've met their treatment goals or they're moving, we're not licensed in their new state, whatever the case may be. Yeah, it's still a loss. It's still a loss of a relationship,
Yeah.
even though it's therapeutic. But yeah, we're on standby waiting for people to come with us, and there's no judgment in whatever the issue is.
Yeah.
That's one of the fun things about just doing the free consultations when people say, "Oh, people are in my family are saying I need therapy." I don't really think so. I only have these issues, and then they'll list things
I
that people
only
only things that like lay people who are outside of the mental health field would be like, "Oh, just set a timer." I just procrastinate a lot. I don't know. I don't go to bed on time. I don't get up on time, and sometimes I have ruminating thoughts, but it's not too bad, right? And I'm thinking, "Oh, there's probably so much behind that curtain." Mhm.
Exactly, exactly. Yes, yes. And I think if
Yeah.
you have to preface it by saying only, I think you're already
Only.
minimizing your stuff.
Already minimizing it. I'm like, "Mhm, we're gonna get in there. We're gonna open that trunk and dig in there and see what you've collected over the years." And that's the fun part, no matter how
Yeah,
big or small people think their issues are. So And I think a lot of people see addictions as, and I used to see it this way too. So I'll be fully transparent on this podcast.
Yeah.
That's my goal. I used to see addictions as one of those very huge issues versus even in the beginning of my coming a psychotherapist, even in the beginning of that journey, starting to break it down and understand the different elements that led to the addiction and not seeing it as this big mountain. Like, oh my goodness, addiction. There's an addiction. It's this big mountain. I don't know how to climb that mountain as a therapist. Well, one, I needed more skills,
Yeah.
I probably should have been consulting with someone like you. And two, I was fearful because of what they told us in grad school about addictions work. Not too many people end up in addictions, you gotta be a unique person to end up in addictions work. And again, when I met you, I thought, oh, if I would have met a Jennifer in grad school, that would have who knows, maybe I would be an addiction specialist because that would have changed the
Yeah.
game for me. Just talking to someone who saw it differently and had
Yeah.
an alternative perspective. So anyhow, I just kind of went on a rant there.
No, that's fine. And I have to be honest, I owe a lot of that to the people I worked for. They ended up being my mentors, and I'm so thankful to them taking the time to walk through it with me and letting me learn and helping me see things differently and not being judgmental and frustrated and really
Yeah.
learning how to walk with my client.
Yeah. And that you just highlight that's so something so important in our field instead of telling people this area is hard or this area is the road less traveled. Really when we're getting our education as psychotherapists, showing both sides. Yeah, it can be challenging to work in this area. And here's what's exhilarating about it. Because now
Yeah.
I'm the therapist who likes a really good challenge. I don't have
Yeah.
the addictions background like you do, right? But now I have matured into the therapist who could handle it because I love the
Yes.
challenge that can come with pulling apart that story and dealing with complex issues and just making it smaller for people to manage and get it treated. So, yeah, I think in education, there needs to be a different approach.
Yeah.
But I'm glad you had mentors and supervisors who were really supportive and nurturing in
Yeah.
that way. Yeah.
Yeah.
I'm curious because since the theme for season 2 is all about the therapist playbook, I'm curious to know how you treat addictions because I would love for people to come away from this episode hearing that we broke some of the stigma around addictions, hearing that it's okay, hearing that this is a lifestyle change and you may if you have the support need to get some support people involved. You may also need to supplement with some community groups and that's okay. How do you treat addictions? Like where do you start with people?
Depending on who's in front of me is depends on where I start. There and I feel this way just about therapy in general. There is no one size fits all. So depending on who I'm with, depends on what modality or intervention that I'm going to use. The most common ones are cognitive behavior therapy, motivational interviewing, rational motive behavior therapy. So, also the ABC model, that's what came out of rational motive behavior therapy, which is really very important. And also, one of the most important things to do when you are working with someone who suffers from addiction is confrontation. I don't mean to be aggressive. That's not what confrontation means, but you have to help that person stay in the reality and not minimize and it for what it is because it's very easy for us to minimize our actions. But the reality is, it's not something that was small. It was something that was bigger. And it's very easy to minimize something and say, oh, well, I kind of slipped up last night, but it's really no big deal because I just slipped up a little. No, it is a big deal. Let's talk about it. Let's talk about everything. Honesty, consistency, and boundaries are some of the most important things when working with people who suffer from addiction. Also, because we're not just talking about addiction, it's co occurring disorders. It's addiction and trauma, addiction, depression, addiction and personality disorders. I can go on, obviously, with the combinations,
Yeah.
but it's very rarely just one thing. So you aren't just treating one thing. You are working with two things at the same time. And that might seem overwhelming, but it's also not too different from what you do with your clients who don't suffer from addiction. You
Mhm.
still want them to learn healthy coping skills. You want them to learn to develop healthy relationships so they don't live in this toxic environment. All these things are very similar, but the thing we're added to this is someone who suffers from addiction. That's the additional component.
Yeah. I like that you highlight the co-occurring disorders and that it's often not just addictions. And so
Yes.
I think your approach to treating people uniquely and assessing like what's going on for this person and not
Yeah.
just, oh, I use CBT with everyone. Like I heard the ABC model, rational emotive behavior therapy, CBT, like you're taking different modalities and just knowing what I know about you, I imagine you're very in a very crafty way applying them to the person's issues and symptoms all while holding them accountable with that
Mhm.
gentle would you describe your confrontation as gentle? I'm curious.
Yes, so let me make up an example because confidentiality is a real
I
thing,
know,
guys.
right?
So
Yep.
what does that look like? That is a great question. So I think sometimes when I have clients who are talking about something and we've gone over it a few times how that's not healthy. A lot of times I will start and say, "Listen, you're not going to love what I'm going to say right now and that is completely valid and we can talk about your feelings right after I'm done saying it. But you know you were not supposed to do that, right? Like we talked about this." And it makes it a little funny, it lightens it a little bit, but also it's let's talk about that. And other ways you know what I think my thing is? I tell them I'm going to do something that's uncomfortable and it kind of preps them a little
Yes.
bit. So I'm softening it and I'm saying, maybe we should dig a little deeper. Maybe that was a little bit more than what you're saying it is. And we go into the truth.
Yeah. So basically we do it the same way. Gentle confrontation.
Probably, yes.
Because what I heard in there was you give them a heads up, and that helps
I
with anxiety.
do.
You give
It
them a heads up.
does because, we're supposed to be the safe place. So
Mhm.
imagine your therapist getting in your face and being like, "You're lying." It's like,
Exactly. Well, and that's probably what they're getting from their family. You're lying. You said you weren't
yes.
gonna drink anymore. Aggressiveness. That's not what they should get from us.
No, no, it's not. And you know what I did miss? I didn't say before when you asked what I use for treatment. Psychoeducation is also so important. And
Yeah.
just to explain what psychoeducation for those who don't know our fancy schmancy terms, really it's just us sharing the information we have with you guys, with the clients. So
Yeah.
sounded really fancy, but it was super basic.
I know, right? It's like we're just providing some education. That's all.
Yeah.
Yeah. You make me think about my like I always picture certain clients, but I'll give a look, right? And they'll say, "Uh-oh." And I'll say,
Yeah.
Now you know it's time to take a deep breath. You're gonna
Yeah.
be okay though. You know I got something coming for you." But then I always say, and when I'm done, you can tell me if I'm wrong. You can completely tear it apart. Like if you don't like what I
Yes.
said, I can handle it. I've been at this for 15 years. So there's nothing you can say that can hurt my feelings. So
Yeah.
just give it to me straight afterwards. So then I say the thing and then they kind of take a deep breath and go, "Ooh, I knew if something was coming,
Yeah.
and then usually people are like, okay, I needed to hear that. I needed to hear that. But I'm throwing some joking in there. I prep them for it. And
Yeah.
I say that to say that whether it's addictions work, whether it's anxiety, depression, trauma, I think it's important for people to hear how we're talking about the way we treat certain things and that it's not confrontational, it's gentle,
Mhm.
but you're
Yeah.
here to be held accountable. So,
Yeah.
but it has to be gentle because of the type of work we do. And we're going to use your personality and our relationship dynamics to kind of
Yes.
weave in some feedback and confrontation for you if it's needed. And then I always try to give people that, hey, tear it apart, tell me where I was wrong at the end so that they know, like, you have autonomy. If I got it wrong or if it doesn't resonate, it doesn't land, let's throw it out then. I'll come up with
Yeah, and I
something
love
new.
that you just said that because I tell my clients too sometimes, like, we can agree to disagree. I may be
Mhm.
saying something, but it's your journey. So you still
Yeah,
make the decisions.
I love that. It's your journey. Imma steal that. I never say something like, "I've never said that." It's your journey. I always say you're walking in those shoes, but I like that better. It's your journey. I'm gonna start using that tomorrow.
Well, it's also their shoes, so I get it.
Yeah. Oh, no, I love that. So if you're coming to get, treatment for addictions, let's say you're working with Jennifer and she's using these strategies that she mentioned. She is giving you personality. She is down to earth. It's clear that you're warm and you're caring, and you're also not just attending to the addiction, you're looking at the other symptoms that might be present that might align with anxiety, depression, trauma, so on and so forth. It sounds very deep. So what kind of self-care do you recommend outside of those support groups? Is that a big part of, like, what you
Yeah.
discuss at the end of sessions with people?
Self care is one of the big things that is talked about in addiction work because the self care you're doing right now is unhealthy. It was
Mhm.
abusing a substance. So you have to learn healthy self care. You have to learn healthy coping skills. And to be honest, I think self care and coping skills are synonymous a lot of times because we're using a coping skill because we're taking care of ourselves.
Yeah.
Some people they need to take a bath at the end of every day to relax and decompress. Some people need to just sing really loud in their car.
Yeah.
And you know what? Do it. Yes, do the things that fill your cup.
Do the healthy things that fill your cup. I think that part is so important, again, because when I think about some of the reasons people go to seek treatment for addictions, it's probably to a point where everyone around them is, like, finally speaking up, like, "I've had it up to here, like, here's how your
Yes.
addiction's impacting everyone." And so there can be this push from the people in their lives to go get the treatment. Just do all the treatment you can and just go get better
Yeah.
versus, "I really want you to come out of this treatment as a balanced person," like, as balanced as possible. And so,
Yeah.
yeah, you go into therapy once a week versus twice because you're also seeing an acupuncturist and a chiropractor,
Yeah.
and you're going swimming, like, okay, those things are helpful too. I'm not just trying to have you in therapy 3 times a week, but you're not having any downtime. So, I love that you said that that's a big part of addictions work.
It is. And, I think it is important that the families get involved because they don't know what this looks like. I think just what you described, they don't know what to expect. And all the things do come up, which also makes the treatment really hard to walk through because as much as you're trying to heal and get better, the bad behaviors don't go away. You have to rebuild trust. And I think rebuilding trust is one of the hardest things people go through when they suffer from addiction because there is a lot of lying that goes on or just unhealthy behaviors, sometimes abusive behaviors, whether it's verbal or physical. And you really violated trust with a lot of people. And to get that back, it is easy to lose it, but it is not easy to get that trust back. And
Yeah.
that's one of the biggest triggers for a lot of people that causes a lot of relapse because their support network is also really angry at them still. So family and couples therapy is a very important piece.
Yeah. Goodness, you're making me think about my professor from grad school, and he's actually here in Florida. His name is Michael Barnes. We got together and had coffee a few months ago, and it was so nice to hear about his foundation. And he does research on and treats the family as well. He puts a lot of focus on the family in addictions treatment because he talks about how, the identified patient, the person who's experiencing the addiction, there's so much pressure on them, so much treatment is pushed on them, and then the family often can get pushed to the sideline and not get adequate treatment. So my question for you is, how can understanding addiction better help us support loved ones who might be going through it? Like the actual understanding of what it is, that psychoeducation you mentioned.
Yeah, I think it is vital. I think it is
Mhm.
vital for the family system because most of the time, depending on the family dynamics, family's not going anywhere. You are going to
Yep.
see these people over and over again, and they have to understand what you are going through because otherwise they have their own assumptions. And you talked about this earlier in the episode where they have assumptions and like, well, why aren't you better now? Or
Yeah.
You're the one with the problem. I still want to go to the bar. I still want to go to this restaurant.
Yeah.
I still want to go to this club, even though that's where you used to score. Like, just say no, right? That's what you
Mhm.
should do. And they need to understand how hard it is, but they also need to be validated that their experiences and the changes that they will need to make to support this person, your feelings are valid, and this is hard.
Yeah. Yeah. How often are you having to refer out for the family members? Because I'm hearing things are changing for the family members too, especially if they live in the same household or if they're parenting together or even co-parenting, if there's a separation involved. That other person might need some support. Are they coming in the therapy room? Like, are people signing releases to have their family come in and get support with you? Are you doing referrals
Yeah.
out?
It's all different. I think sometimes
Yeah.
a family session here and there is okay. Obviously, if they need ongoing family sessions, then I do refer them out because that
Yeah.
client is my client. But I think all the members in the family should get their own individual therapy because they have to learn consistency with healthy boundaries. Most of these people have been enablers. They don't know how
Yeah.
not to enable. Well, that's really important because this person will relapse.
Yep. And we want to focus on relapse prevention. So if people can get
Yes.
those referrals and get in therapy, then we're just building stronger families by doing that. Everyone seeking
Yeah.
support, getting help.
And it's important
Okay.
to be consistent with your healthy boundaries.
Yep. I agree. In terms of people needing a higher level of care, when you're working with them in your private practice on an individual basis, what are some of the signs for you that you need to refer out? And then the second question, I think I know the answer to it, but like, Jennifer, what do you do to build relationships with treatment centers in the community to make sure that you have places that you trust to refer people to?
Yeah. So I'll start with the easier part of that question. I think meeting people in the community is really important. Luckily, a lot of the people from those places are coming and reaching out to individual therapists, so we are aware of them. But one of the most important things I do is I do tour the facility because some of them are not great. Some are not practicing appropriate care. So I do ask a lot of questions about what they're doing, how they're doing, what their success rate is. And then as far as how do we know someone needs a higher level of care, what we're doing is not working. That's basically how I know.
Yep.
Not only are we looking at it's not working, is it not working because they're still trying really hard, but there's something missing and they need that extra support? But then there's also, it's not working because they're not ready for it.
Yeah. And that part is scary because it is
Yeah.
impacting them and so many people around them and their livelihood, their jobs, just everything. So addictions treatment is so important. And I think where you go a step above even where I go, and I think this is important for people to hear, is you not only make the connection with the treatment centers, you actually go there. That is impressive.
Yes. Thank you. I am very passionate about proper treatment for addiction because I have seen improper treatment and
Yeah.
how it really affects that person's ability to move forward, have success in their recovery and their sobriety. And it's not fair to that person. They've already worked so hard. They did the hardest thing where they asked for help, the second hardest thing, or equal to that first hardest thing. They admitted that they suffer from addiction. Those are
Yeah.
two really hard things. And to set them up somewhere where the care isn't great, you're basically setting them up to relapse.
Yep. Yep. I think if you're listening to this and you are struggling with addictions or you know someone who is struggling, I really hope that you absorb everything that Jennifer said and not so much the isolated things that she said, but just in its totality. It takes so much for people to come to seek support. So you deserve to have a provider who knows how to properly assess, properly treat, and properly refer out if you're not getting better. And I have heard of providers who keep working with people and there's no progress. People are spiraling, they're getting worse. You deserve someone who says, okay, you're not getting better. And I can tell you want this. You're doing the work. And so
Mhm.
I have collaborated with this treatment center, or I have toured this treatment center. I have a contact here. I can make sure you continue to get care. There's some continuity of care there. And oftentimes, and Jennifer, you can correct me if I'm wrong because I'm not in the addictions field. Oftentimes, your individual therapist that you were working with can also collaborate with the providers at the treatment center to make sure you're getting good wraparound care. So I know I'm saying this, Jennifer, because I know that I've heard some people say, well, my therapist just sent me there and then they were done with me. And then all these new people and I didn't feel comfortable opening up. I've gone above and beyond when I've referred people out to a treatment center. Like, look, sign the release. I will talk to them. I will be a part of that planning for you for discharge, and people deserve that. So,
No,
yeah,
I
they do.
agree because the clients wouldn't know to do that, and that's
Yeah.
why I'm particular about who I refer to because I know the places I'm referring to will do those things. They automatically say, "Sign the release of information, let us
Mhm.
connect," and then go back to your therapist afterwards because you just did this intensive treatment. We'll continue with the support to help you implement it. You can't go from therapy 3 times a week to then nothing. That's not the healthiest way to go about it, so that coordination of care you're talking about, absolutely.
Yeah, it's so important.
Yeah,
Ooh, this is getting deep, girl.
that's right.
This is
That's right,
getting
that's
this
what
how
it's
we do.
about.
We get
Yeah.
deep with you, okay? So if someone is considering therapy for the first time and they're struggling with addiction, what is one piece of advice you would offer them to help them get over the threshold of that fear?
You know what? I would say it's okay to be a little fearful. This is scary, you know?
Mhm.
Sometimes we have to walk through that to kind of get to the other side. So I think I would just say it's okay to be scared. This is a scary thing. You're looking for someone, you don't know them from a hole in the wall, and you're just about to dump your entire life on them. That's scary. I do think it's important to recognize that therapists do offer most of the time a free consultation. Take them up on that. Make sure you feel comfortable with them. A lot of times you could do that via telehealth too, so you can see them. And the other thing I would say is if you started working with a therapist and you are not feeling it, you are not vibing, go see another therapist. Do not stop. I know that can feel really discouraging going back to that feeling of fear and scared, but it's important, and it's okay if someone isn't the right fit. Sometimes we find a primary care doctor and we meet them and they're jerks, and we need to go find another one, and that's
Yep.
okay. Exactly. Not everyone's the right fit. So if you're scared, that's okay. And that would be a normal reaction to doing something new. So your feelings
Yeah.
are valid.
Your feelings are valid. That's such a therapist response. I just want to validate your fear. I know you're scared. It's okay to be scared. You can sit in that fear. I will sit with you in that fear.
Exactly. We will sit with you. But yeah, it's gonna be uncomfortable. It's like a first date. It's really uncomfortable. We kinda don't know this person. We're hoping we make a
Yeah.
good first impression and, maybe we get their number at the end. I don't know.
No, it does feel like a first therapy date. I
It
should
is.
do an episode on that, how to navigate the first therapy date. But really though, I think it can be so intimidating to and I've had several therapists throughout, 20s,
Yeah.
30s, and now 40s. And it's intimidating to see a therapist. And sometimes it is just like, okay, this is just a part of the process. I am gonna be fearful versus the cliche response of it's fine, just go to therapy. Everybody's going to therapy now. Well, that doesn't validate the fear because it's just going to be there. So I loved your response. Is there anything we didn't hit on today in kind of exploring this topic that you think is important for people to hear?
No, I think we hit everything. Yeah.
Yeah, I really enjoyed our discussion. And as always, when we link up, it's just a good time. It's
It
down to
is.
earth.
It is.
And are you only licensed in Florida or are you licensed in other states too?
I am only licensed in Florida, but I also offer life coaching for
Okay.
all states. Yeah.
Nice. Oh, can you
Yeah.
tell us a little bit about the life coaching? Like who your target audience
Yeah.
is for that?
You know what? I think anyone who feels like they need it. I just love working with everyone. I think if you took the time to say, I need help with something, I am down for that journey with you. Like, let's go. Absolutely.
Let's go. I love it.
Yeah.
So, how can people contact you? How can they get in touch?
So, excellent question. So, my website is jbcounselingfl.com. You can also email me, Jennifer at jbcounselingfl.com. And you can also find me on Psychology Today.
Perfect. And I'll put all of that in the show notes for everyone too. Jennifer, I've really appreciated your time today on a busy weekend, just sitting with me to talk about one of your favorite topics, addictions.
It
And
is.
I I also think it's important to say that I'm educated too when I meet with providers who have a specialty that I don't hold. I think that helps break the stigma too for people listening. I too am being educated because I don't treat addictions. So, and you never know who might be a provider and listens to this and says, you know what? I was always afraid to go into addictions work, and listening to Jennifer, I think I'm going to give it a shot. I'm going to start getting more training in that area because my understanding is there are more people needed in the field. So,
Yes.
yep.
There are many more people needed in the field. Absolutely. Yeah.
Yeah. So, hey, whoever you are, wherever you are, you know how to reach Jennifer. If you didn't catch it, it'll be in the show notes. I really appreciate you listening to this episode where we're talking about understanding addictions work and actually peeling back the curtain to show you, or tell you rather, how it's done, how it's approached. If you're looking for therapy and you are anywhere in the state of Florida, Jennifer offers in-person and telehealth for
That's
therapy.
correct.
Perfect.
Yes.
And then also life coaching. So we will see you in the next episode. Thank you for your time. The Anxiety and Free podcast is sponsored by Find My Therapist, connecting you with therapists at findmytherapist.us. If you found today's episode helpful, please share it with someone who might need it. Tune in next week for more conversations on navigating mental health and finding your freedom.